Welcome back here on Live Impact News on WCNC Plus. I'm Nick Serterman. We have a special guest. Our next guest is the CEO of a nonprofit that provides health services for the uninsured, underinsured, and for those lacking, affordable, high-quality preventative health care, serving thousands of folks, good folks here in Mecklenburg County. The two areas of focus: access to care and maternal child health. Welcome. First-time guest here on Live Impact News, Tchernavia Montgomery, CEO of Caring.
Yes.
How are you doing?
I'm well. First time and hopefully not the last.
Hopefully not the last. I feel like we had a whole interview before the interview.
We did. Good food, travel, Carolina, Alabama.
Mobile. No, I said Mobile. No, did I get it right? Mobile. Okay.
Well, Pritchard, if you're being specific.
How far is Pritchard from Mobile?
It's right. This is like we were saying Matthews to Charlotte, so a little suburb.
Now I got to ask, I've never been to Alabama. I worked in Georgia. I worked in Atlanta, so I got close to Alabama.
Yes.
What was that like growing up?
So it is the South. It's the home of Mardi Gras. It's important that people know that Mobile is the home of Mardi Gras, not New Orleans.
I didn't know that.
Yes. Good food, good people. Mm-hmm. Yes.
And you've been in North Carolina for a while, Eastern North Carolina.
Since 92, yes.
92,
yes.
Eastern North Carolina.
Carolina's home, yeah.
And you told me, was it white sweet potato?
Yeah, we were talking about white sweet potatoes as you're going to the more southern part of the state. You can get white sweet potatoes. Okay. You can start to get a few other items that you might not be able to pick up here in Charlotte. Because
I was like, white sweet, I didn't even know how to, my brain just couldn't even, okay, all right. And you said bake it?
Bake it, bake it. Poke a few holes in it, wrap it in some foil, throw it in the oven, a little butter. A little bit of sugar.
A little bit of sugar?
It's a sweeter potato.
Because I love
I'm
brown
not going
sugar.
to judge how you dress
Okay,
your
all right,
okay.
We'll leave it at that. Again, CEO of Caring.
Yes.
Talk about the work you guys do.
Yes, so we have been around since 1955. Mm-hmm. We were founded by a community health nurse, Maribel, who did not look like me, but who started door knocking in the historic West End of Charlotte. She wanted to help individuals who were experiencing disparities, especially with heart conditions in that decade, and help to close those gaps. We've been around since that time, have grown to serve about 10,000 people a year in Mecklenburg County who are either uninsured or underserved in some capacity. We have a wide range of services along our continuum, from a donations-based primary care clinic, so lots of hypertension and diabetes management. We have a large donated care program called Physicians Reach Out that's in its 20th year, where we receive about $70 million in donated care from our 2 local hospital systems and a large number of other private practices. We have 2 thriving maternal child health programs that are enrolling pregnant women and working with the child until age 2. And in our new location that we relocated to last year, we have a full-service food pantry in partnership with Nourish Up and the American Heart Association.
So y'all do a lot.
We do. We are deepening the work that we do. We are broadening our footprint, and we've been very fortunate to be able to experience this new evolution of care.
What's the biggest need right now? I mean, I feel like there are a lot of big needs.
Absolutely.
But what's top of the list right now?
Access to care. We don't always understand how broad that term is. Access could be transportation. Can I get to my doctor's appointment? It could be, is there cultural competency when I arrive to that appointment? It could be, do they have all of the different levels of care that I need when I arrive? It's a number of things, but that is a challenge that we are trying to help our patients and the community navigate, is how we help individuals get from point A to point B with greater ease.
I think a lot of folks, I used to hear, and I still hear it now, it's not going to the doctor, finding out what you have or what's plaguing you. It's paying for it. It's not having the insurance, right? That's the boogeyman right there.
Absolutely. And it's also those social determinants of health. We've learned that 80% of someone's health has nothing to do with their physical or genetic code. It's things like transportation and housing, and do I have green space, my environment that I'm in? Do I have housing instability? It's all of those other things that further complicate the care that someone is getting. If my doctor tells me that I have diabetes and I need to eat better, but I have no access to healthy foods or a way to get them, it's going to be kind of hard for me to manage that.
What's your biggest challenge? What keeps you up at night?
Oh, a number of things. I actually sleep really well at night because we are doing the Lord's work. So we are really helping to solve problems that have existed for a very long time and helping to close those gaps, one of which being the infant mortality rate in Mecklenburg County and maternal morbidity. It's really, really good work that we're doing. But of course, right now, there's a lot of uncertainty in the nonprofit environment, and we're navigating that as best we can, and we're really fortunate to have the support that we have.
Is it really, and I've talked to folks off the record, as far as the inner workings of nonprofits, is it really like a month-by-month sort of situation you guys go through?
Absolutely.
Yeah.
It's, I think I would love, a question was asked of me the other day, what do nonprofit leaders want their boards and community partners to understand? And it is the complexity of our financial arrangements. We do work month to month. We don't always have sustainable funds or a revenue stream that's repeatable or renewable each month. We really are navigating a lot of change today and have to be creative in how we do our work. But the people we're serving have to be creative every single day in how they're navigating their lives. So we're just really walking along the path that they walk each day alongside them.
Like if they're going through the fight, we're essentially the mindset is we're going to continue to fight as well.
Absolutely. And we want the rest of the community, the corporate community, the other nonprofit partners, I say grassroots to grass tops, right? The foundations, individuals will take $5 that you have, or we'll take 500, 5,000, right? Every dollar matters because you're investing in the care of someone in need in our community. And we have community challenges. We don't have an individual person challenge.
They'll take $50,000, $500,000. I just $5 million. I just want to go on. I just want to don't limit yourself now.
No, and people do want to be philanthropic. Yeah. They want to serve. They want to find ways to help and to give back. And our goal is just to try to connect them, that passion with our purpose and the work we do, and try to have some results.
You mentioned West Charlotte coming up next week. The Maternal Health Conference at Friendship Missionary Baptist Church.
Yes.
A legendary church.
It's my church.
It's your church.
It's
okay.
my church.
Okay.
Yes.
Okay.
Yes.
On Beatty's Ford Road.
Yes.
They do incredible work there.
They do.
Talk about how this kind of came together, and I tried to get a quick summary of what's happening, but it's a lot happening.
Yes.
And I'm like, I'm not even going to I'm gonna let you take that away, but a lot happening in a good way. Explain to us what this conference is.
Well, you are welcome to join us. We'll have a little bit of everyone there. Our goal, it's National Maternal Health Month is April. So we try to host a conference each month that is focused on gathering birthing and health professionals and families in the community and centering them around education and networking opportunities that are going to help improve birth outcomes for individuals in our community and reduce instances of infant and maternal mortality. We believe that in gathering collectively, we get a sense of the work that needs to be done to help us row in the same direction, and we can see positive results like we've seen in the last year with the recently released infant mortality report.
What was your biggest takeaway? Because I know we did some reporting around that report. Your biggest takeaway from seeing that report?
Is that we are improving. I think we are on a 10-year low for infant mortality in Mecklenburg County. Care rings programs have always been robust, but we experienced a boom about 4 years ago. So we believe that the work that we're doing, especially around home visitation, in collaboration with our partners, is helping to ensure that moms are healthy during the gestational period, and that once they have their babies, they're able to focus in on some of those early childhood education elements that we know are critical to baby being ready for kindergarten and ready to thrive. So we are absolutely doing the work and really proud, and this conference will join about 400 plus individuals around the country. It's not just Mecklenburg County. We went virtual last year, so we're going to do that again, but it is really having collective impact and action around this very important topic.
What are you looking forward to as far as the conference? I know you got a lot of work building up to it.
Yes.
I know the day of,
Yes.
you'll be doing a lot of work, but what are you looking forward to the most?
So I'm grateful for the support we get. The conference is presented by Novant Health and in partnership with Atrium Health, Mecklenburg County, and a host of other grassroots to grass top partners. And I get excited about the fellowship that happens. People seeing one another every year. It's become sort of a family reunion. We eat good. That's really important. We have really critical topics that we discuss. We have a fatherhood initiative. We talk about eating healthy. We talk about heart health. We know that hypertension and other heart-related conditions are the #1 reason for maternal morbidity, and also access to care. How do we help our families navigate a very complicated health system so that they can get the services they need? And then just hearing inspirational stories, hearing people talk about their journeys and their challenges towards being where they are today, where they're able to now help uplift others that are doing the work.
I asked you, I know you say you get great sleep. What keeps you up at night? What keeps you going?
The people, the work that we're doing. I was a very young mom, became a mom at 15, and I was fortunate enough to be enrolled in a program very similar to the programs that we have in our community. And it was the sisterhood, it was the education, it was the reassurance, and just the empowerment I felt through those programs that helped me to be where I am today. So I get great sleep in knowing that I'm helping to grow a program or a number of programs that are hopefully going to have the same impact. And when I say impact, I mean it, because we are seeing those numbers start to decrease. We have still very deep disparities that we need to address, especially with Black women and Black babies who are 3 times more likely to die in the first year of life. We have work to do, but to see that overall we are improving in this effort tells me that we're doing something right and we're going in the right direction.
You guys do incredible work.
Thank you.
A lot of that is because you're getting great sleep. I'm working on my sleep.
I could use a few more hours, but I'm energized. I love my job, very passionate. I have a great team, and the enthusiasm for what we do, we feel is contagious in this community, and we want to keep that going.
One last question before I let you go. For folks who attend, what's one thing? I know you said a lot of great things, but what's one thing you want those folks to take away next week?
Well, we've intentionally kept our costs low. So we have a few in-person slots that are left, but encourage people that want to have the virtual experience to join us. I think we're starting at $35 because we want it to be accessible. The information that we have is information that anyone can take back to their families, to their places of work or worship, or groups that they're within. We need for women to be healthy. We have local policies like our prenatal to 3 strategic plan that's serving as a roadmap for maternal health and how we're going to navigate in the future. And then we have national policies like Congresswoman Adams' Momnibus Act, set of 14 bills that are intentionally going to help us drive workforce improvements in maternal health and making sure that women have access to care before, during, and after pregnancy. But it's information that we all can use. It's not just dedicated to birthing professionals or healthcare workers. All of us can do better about making sure that mom and baby and the village that's surrounding is healthy, happy, and thriving.
Oh man, I'm looking forward to the conference. I
don't have any white sweet potatoes, but you are welcome to come by.
See, that was my next question.
Gotta do a callback.
Now I gotta reconsider.
That's your job. Yes.
But great work.
Thank
Ring is doing Tchernavia Montgomery here, CEO. A really important organization here in Mecklenburg County. Ring, again, 2026 Maternal Health Conference, April 9th at Friendship Missionary Baptist Church. Thank you for stopping by.
Thank you.
And next time, you swipe white sweet potatoes?
We'll see.
You're going to, okay, all right, okay. I'll bring the fried deer nuggets.
Okay, we got a meal. We're building a meal. I see it.
Thank you for stopping by.
Thank you.
Let's take a quick break.